Hello everyone, welcome back to my nursing channel. So I am one of the student, currently a student as well, studying nursing in Australia, and I'm just trying to share my thoughts about nursing and what I have understand so far about nursing. I'm about to finish my enroll nurse as an enroll nurse and about to like get into bachelor's of nursing. So I'm gonna give you like a quick introduction about what nursing is in Australia and how much money an international student is supposed to pay to get in here. So basically, nursing is really a favorable course in Australia where a lot of people want to study it because it has a lot of advantage to it. At the same time, it has cons as well. But you can get PR. It's a good job. It has a good pay. It's a reputable job. A lot of people wanted to get into this, and there is a huge demand of this job, unfortunately, and very few people are there. So that is why nursing is in this high demand where a lot of international students basically want to get in. And so there are two types of nursing. One is enroll nurse, another is RN. So RN is registered nurse, EN are enroll nurse, and I am basically, what I did was I am EN leading to bachelor's. That means I am trying to be an enroll nurse first, and then after that I will study further to be an RN. You can choose to go directly to be an RN through Bachelor of Nursing, but I chose that other route because of some circumstances. So as a EN, you have to study for 1.5 year or 18 months, um, or it can last for 2 years sometimes as well if you have some sort of issue with your course. But normally it's 1.5 year as a EN, and after that you have to study 2 years because the credit score will transfer easily. So this is what EN and RN is. Now there are different job roles there. What RN does, what RN or EN does in a hospital setting, that's a different thing. I'll make a different video on that. So how much money an international student have to pay as someone who is eager to study nursing here, right? So if you are someone who want to go through the way I am trying to go is through diploma of nursing leading to bachelor of nursing. So if you go through diploma of nursing, then you have to roughly pay around, it depends on university institute where are you studying, because I heard that a lot of institute also start studying teaching EN. So I don't know about it, but I am in university, so it might be a different case for me. So as a enroll nurse, how much money in 1.5 year you have to pay depends on how much scholarship you have got, what kind of GPA you have, um, and what country you are coming from, because there are a lot of I think they have like some sort of funding. Some people get funding as well, but basically in ballpark I would say around from $30,000 to around 35. So that is the approx spark I can say right now. And after that, after you completed all of your units in enrollers and 1.5 years completed, you have to like upgrade it by your opera. And once you get that certification, you can enroll into becoming an RN within 2 years. So you just have to study 2 years, right? So in that 2 years time, again it depends on how much scholarship you got, and it might be roughly from, depends on university, where are you studying, what is the level of university, where is the place, where are you coming from. There are a lot of things that differs, but roughly I would say maybe from like 60 to $80,000. And when you calculate the overall calculation in today's, that in 2026 it would be roughly around $100,000. And because the rate of every institute or university goes up by like 10% every year, because they kind of like increase the um, university fees every year by 10%. That plays a huge role as well, and kind of really hard for international students. So you can, if you are trying to get into nursing, this is what you can keep in your mind, that you are investing like a huge amount of money, like $100,000, and it's your responsibility that how you gonna fulfill that um, path of becoming an RN in Australia. But once you become an RN, and if you have that kind of skill, and once you carve that path for yourself, then it's kind of easier. But itself, nursing is a very hard and very tough job where you need to be mentally and physically strong. At the same time, there are a lot of things that comes into play. but but as for someone who is looking into study um, nursing in Australia, wherever, Melbourne, Sydney, Brisbane, Canberra, wherever it is, uh, it's just that you have to like, I will just approx $100,000 plus like rent, accommodation, the bills, the grocery, whatever that is, like just keep aside those things. But solely that is how much you are paying. But if you get lucky, like some people get 25%, some people get half, 12.5% scholarship, and it totally depends on the circumstance, but that is how you have to do it. And there are a lot of people who are paying 100 grand and becoming RN at the end, and that's and some people think that's worth paying that some amount of money, and I feel that same way. That's why I get into this thing. But it's just like a hindsight of how I think about is that it's I'm like get I'm about to be graduate as a EN, so I feel like it's worth the money if you are interested into like pursuing this path, and if your goal is to um, contribute to hospital settings, then. But if you're someone who is not capable enough, or not capable enough, but if you are not interested in this kind of medical thing, then it would be better if you rather save that huge amount of money and invest in something else. But yeah, that would be my advice for anyone. And subscribe this channel. I will be coming up with a lot of videos regarding nursing and whatever I'm learning throughout the way. And thank you for watching the video. Thank you very much.